All right, we're going to get started, so go ahead and find a seat if you can. Welcome to 1 Million Cups. Raise your hand if it's your first time. Yay. Awesome. Welcome Turner, West Platte, and Leavenworth High Schools. Thank you for coming. Give them a round of applause. My name is Caitlin. This is Kyle, Billy, Courtney, Tyler, and John is in the back waving. And we're your organizers. If you could do us a favor and take out your phone and download the 1 Million Cups app, it allows you to give direct feedback to the presenters, which they appreciate very much. Since a lot of you have never been here, here's how it works. Each presenter will present for about 6 minutes and tell you about their business. Then we'll pass it over to our expert panel to ask some questions, and then we'll open it up to the audience for questions. So just raise your hand if you have a question, and we'll come and bring you a mic. And we'll have our experts now introduce themselves. Grant Gooding and Allison Edwards.
Good morning.
Morning.
The microphone works. My name is Grant Gooding. I have a company called Proof Positioning where we focus on emotional measurement of customers. Essentially, we can tell businesses what to say to who using what mediums in order to increase their propensity to buy.
And I'm Allison Edwards. I'm a family practice physician. I own and operate Kansas City Direct Primary Care. We are a primary care clinic that does full spectrum primary care without the insurance intermediary. So we do unlimited primary care for a flat monthly fee, no copays, no hassle, no drama, very human relationship. So I'm very excited to be here today.
Thanks for being here. All right, we're going to get right to it. So please give a warm welcome to Bo Lace with Lula.
Good morning, everybody. I'm Bo Lace, CEO and founder of Lula. And 2 years ago, during the summer, my wife and I decided to buy our first house together. And as soon as we got settled in, we decided to have all the in-laws in town so they could check out the new place. Well, that Friday that they're getting ready to arrive, in the morning, my wife hands me a to-do list. It comprises of mowing the lawn, cleaning the boys' bedrooms, and things of that nature. Well, what happened is, as soon as I started helping her later that day, Friday, before the in-laws were supposed to arrive, my air conditioner just decides to quit working. And so immediately the first thing I do is I start searching on Google, sifting through reviews on Angie's List and Yelp, and then I start making phone calls. And I start calling HVAC contracting companies, and a few of them didn't bother to even answer the phone. A couple of them said they had no one available in my area today to actually come service my needs. Finally, I was just fed up, and I decided, let me call a good friend of mine, which happens to also be my insurance agent. And I said, listen, this is the situation. Do you have anybody that you insure that owns an HVAC company that could possibly help me out? He made a few phone calls, and he was able to get someone to come out and service my needs. And about that time that he showed up, the in-laws started arriving. So I thought that, yes, I just avoided a huge disaster, but my wife didn't seem to think so because I wasn't able to finish that to-do list for her. So as I slept on the couch that night, I started thinking to myself, there has to be a better way to get quality home service professionals when you need them at a fair market price. Well, as I started digging through and trying to solve that pain point for homeowners that I experienced, I quickly learned that providers had even more frustration in this process. So what happened is I started to learn that they're fed up with the lead referral markets, the upfront costs associated with them, and the constant bidding wars. What's happening is that there's a race to the bottom in these lead referral markets where they're underbidding each other, and then they actually get the job. They end up having to cut corners because they won't make any money, and then it's a poor result for the homeowner. So what we've done is we've created a solution that allows homeowners with just a few taps from their mobile device to get fully vetted home service quality professionals to their doorstep in just a couple hours, all while knowing exactly what you're going to pay. Our platform has no upfront cost for service providers. There's no bidding wars because we're delivering real jobs, not leads. The first provider that actually claims that job gets it. It's off the board. It's immediate revenue because before a homeowner can actually request a service, they have to have payment information on file, so it's money in the bank. And then I'll hit on this in a few minutes, but we have a solution not just for the independent contractors, but for really good companies that have that are larger, that have fleets of 20, 30, and 100 people out in the field. So this is the consumer-facing app. You can enter as many properties as you want. Once you have your property, you select your location, you can actually see some of the services that we offer. And then we actually deliver upfront pricing for those specific services. You can request service for now, which means that we'll have someone to your doorstep within 4 hours to take care of that need. Or you can schedule for later, which means you can choose a certain date and time. When you submit that request, all providers that are available within your area are going to get a notification. They can look at that notification and then they'll be able to see exactly the job details, date and time, the cost, property information. They can decide if they want to claim it or if they want to pass. Our providers are learning that if they they need to claim the job, it's a job they want because someone else on the platform is going to snatch it up. When they're ready to head to your location, they'll actually click en route so that you know as a homeowner exactly when they're going to show up. You'll receive that notification to your phone when they're heading that way, so you're not waiting around all day wondering when they're going to show up. And then once the job is completed to the customer satisfaction, we'll process payment. You'll both receive a receipt. So how do we make all this work? We are not bucket pricing. We are not giving you a range. That is not helpful. We are taking your property information because your property and your property and your property is all unique. So we take things such as square footage, number of bedrooms, number of bathrooms, do you have pets, do you smoke? We take that information along with the fair city market data pricing in your area that you live, implement that into our proprietary pricing algorithms, and then deliver you the upfront price. So what's really cool for the larger providers, this is something that no one else is doing right now, is that we just, from day one, we built a solution that just wasn't for independent contractors, but also for some of the really great reputable companies in town that have fleets of 20, 30, or 40 out there, so that their fleet managers at the office can actually see the incoming jobs, claim those jobs, and then push them out to the employees out in the field, because these employees are expiring assets to them. So when there's gaps in their schedule, we're able to fill that void. This also makes our model easier to scale when we decide to enter other markets. So right now, there's $60 billion being spent on the on-demand economy in the US. $8 billion of that is on home services, and we've identified with the services we're going to roll out, there's $3 billion being spent on the services that Lula is going to have. Our revenue model is pretty simple. We charge 20% of every completed transaction. We are not making money unless the provider is making money. So we launched a beta in this past July, and we have not spent a dollar on marketing to date, and we were able to get 1,500 Kansas City homeowners through word of mouth, blog, and startup events that signed up that wanted to participate in our beta program. We have over 500 professional providers in Kansas City that have been approved. And to give you an idea of how rigorous our vetting process is to ensure quality, we've only accepted less than 20% of all applicants. And you read that right, we're launching today. So our app is officially in the store today, so you can go and download it, and we'll talk about that a little bit more here in a minute. So in case you were all wondering what life's been since I've had Lula in my pocket 24/7, I'm now graduated back into the bedroom, and my to-do list is quickly knocked off. Thank you for your time.
All right, we're going to open it up to our expert panelists. Go ahead.
Hey, Bo, thanks, man.
Yep.
That was actually you in the pictures, wasn't it?
It was.
That's what I thought.
Camera adds 20 pounds.
So I think there's, it's a really interesting idea, right? But I do have a few questions. So first of all, I think this could be a really solid supplement to some of these larger companies that really are looking for other ways to advertise or create lead generation. I think that's smart, and that's probably a good avenue to go down initially, and it sounds like you're getting supply. But my concern is, when you started this, right, when you were calling and looking at reviews, why were you doing that?
Because I couldn't find anybody to fill a need I had right in front of me at that time.
And so by looking at those reviews and things, you were trying to establish what?
I was trying to establish who to call. I didn't even know who to call at the time.
Okay, so, but you don't look at reviews to find out who to call. You're looking at reviews to do what?
To find out who the quality providers are.
That's right. Right? And then you called them, and then based on the conversation that you had with the person on the end of the line or what kind of process they had, you made an emotional decision to hire a specific person. Fair?
Well, I couldn't get anyone to come out that day, but
But the point was that you were looking at reviews because you didn't know and you were trying to establish credibility. And you were
Correct.
trying to establish, all right, who's really good here? Because I have no metric on that.
correct.
So the concern that I have when I see this just at a high level is I don't see that. I don't see that you are taking that emotional credibility and baking it into this. It's just a provider is going to show up and you need to trust us that we have vetted them. But what are the quantitative and qualitative ways that you are doing the vetting? Because in order for this to be successful, you have to establish yourself as being, hey, we've vetted these people and here's how we've done it.
Yep.
Because if you haven't established that, people are going to go back to reviews.
Absolutely, and you make a very good point. And we actually have what our vetting process is when we have more than 6 minutes to present. But basically what we're doing is we do check their reviews. We actually do a background check, but a lot of people do background
So
check.
you don't have to tell me, right? It needs to come through. It needs to come through in your basic, clear messaging, right?
Okay, sure.
Or in a very simple execution. So let's look at Uber just for example, right? 'Cause there's some Uberness to this to some extent, right?
Correct.
Well, Uberness, you can see, here's the location, and then you can see the rating of, they have crowdsourced star rating for a driver. So there's a very simple way that they establish credibility using that model. That could be something that you could totally copycat, and I think it would work.
Sure.
But, and speaking again to your messaging, so if I were sitting around with my neighbors, right, and we were drinking beer or something, and I had somebody come out to close our sprinklers down, and they'd be like, oh, who'd you use? And I'd say, I actually don't really know, but I use this cool new service called Lula. And they would be like, oh, well, what is it? And then I might say, this is a direct quote from your website, this is like the first thing that people see. Well, very simply, Lula uses proprietary mobile app technology to instantaneously provide you on-demand home services. And then they would look at me and say, what the hell did you just say? Right?
Yep.
So for a moment, I think as you're moving forward and you're building this, right, and we're a startup, and I think you got something here. Think about your customer and put yourself, go back, because you build this whole thing, and it's tough because you're kind of, it's tough because you're in the weeds, right? Put yourself in the position of your customer and say, how the hell would they talk about this?
Sure.
Right? It's tough. It's a tough thing to do, but it's definitely missing here, I think.
Yep. That's very good feedback. And we just finished up a rebranding process to try to make that message more clear, and we haven't had time. We're actually redoing the website now because it was all over the board. It didn't make sense. So, but very good point.
Otherwise, I think this is awesome, and I'm excited to see where you guys go.
Appreciate it.
Do you have a more succinct one-liner instead of that one that
Well,
you want to share?
our one-liner is smarter home services.
I like
Now,
that.
as far as branding, we're saying, don't call your cousin. Lula has the pros, right? We're trying to let you know that we have the pros.
Awesome. So as a startup myself, I often get the question, how do you price your services? And so I think it's fascinating, and you don't have to go into your proprietary formula, but a couple of things. Where did you get that set point? And is it dynamic? Does it change with supply and demand? Is it something where the service professionals are weighing in heavily, the customer? How do you even wrap your head around that?
So what we've done is, as far as supply and demand, you make a good point. That's on a future roadmap, potentially. We'll get there. But we spent a ton of time with our providers. And so some of the pushback we got from consumers was, well, I like to hire the independent guy because he's going to be less expensive than the large company size that has 20, 50, 100 people in their fleet. But what people don't understand is that there is a ton of overhead and customer acquisition costs for larger providers that sometimes these smaller independents don't have. And so we're actually erasing that customer acquisition cost for these larger providers, so they're willing to allow us to provide the pricing because of that customer acquisition cost. It's just eliminated. So we've worked heavy with them. What we're going to find out here soon is, okay, what is the consumer's going to pay, right? And that's when we'll find our product market fit. And we do have room to make adjustments What's neat about our platform is that I could literally take out my phone right now in the admin and change pricing on the fly if we needed to. So we're going to be lean and agile and adjust those pricing as we see fit. Right now, the market's going to have to tell us.
All right. We're going to turn it over to audience questions. Guys, get your hands up. I've got one over here. Let me run. You're going to give me my exercise today, man. There you go.
I actually had a few questions for you. So I understand that you have a bunch of providers. Do you sell the software to the providers and make the 20% off of the payments extra, or how exactly does that work?
Yeah, so there's no upfront cost to the providers. We are not selling our software right now. It was architected so it could be white labeled, but our focus right now is our core business model, and we may venture into something down the road. We just don't know where the market's going to take us, to be honest.
Okay, and also, so in your app, you said that it's up to the provider to choose if they want to do it or not. So how can you guarantee the customer is even going to get the service?
Yeah, so it's a two-sided market, right? So there's supply and demand, and that's tricky. So, I ask all of you, be patient with this. We are not going to be without flaws, but I promise you this, give us feedback. Even if you install the app and use it and then decide, there's no services on here yet that I want to use, or maybe the price is too high, give us that feedback, because we are lean and we are agile and we're going to constantly improve. That's our promise to you. But, what we're seeing is that because we are an on-demand service, that providers, when a lead comes in, or not a lead, a job, when a job comes in, they quickly look at it to see if it's something they want because they know another provider is available that might take it. And so that's how we encourage these jobs to fly off the board.
Awesome, thank you.
Question in back.
Hi, my name's Jessie Huft. I think your product is really great. As a homeowner, I would definitely use it. I have two questions. For a subscriber, have you considered Airbnb hosts? I think as a host myself, I would definitely download your app and use that. So that's question number one. Question number two is, have you thought about how you might circumvent a provider and a subscriber going around the system and exchanging personal information and then them just contacting one another and having that relationship going forward?
Sure. So to answer your first question, there's a lot of different opportunities here. We are talking with property managers. To go to your first question, the Airbnb host is a great idea. Haven't thought of that one, but we are talking to property managers, and we actually just entered into a partnership with a company here in town called Homebase. And so we're going to be offering our services through their platform as a value add to all their tenants. And plus, they have move-ins and move-out cleanings all the time. So that's another channel that we're taking. To your second question, what we call that is leakage, right? So that's leakage of people circumventing and going around the platform. There is no way to completely eliminate that. There just isn't. People are trying. We could threaten and be like, we're going to kick you off the platform. But we really are built on relationships with our providers that understand that, hey, we're eliminating some pain points. Now, if a customer engages in a lawn care service or an HVAC service and wants to do that, we can't stop it. But we only have a few services today, but on our roadmap we have hundreds. And if we can make the experience so great as you for a homeowner with one service, why wouldn't you come back to do additional services? And that's really our goal.
Question on your left.
Okay, you stated that you had a beta. How long did you have that beta up for, and how much profit did you make, if any?
Where are you? Okay. So for the beta, we had the beta from July 15th until we just recently shut it down just a few weeks ago, actually. And we did a lot of promos where we were giving 25%, 50% off. And revenue today, we have close to a little over 5,000, but we were a bootstrap startup. And we actually, until recently, funded this ourselves. And so we could only allow, even though we had an overwhelming 1,500 people that wanted to participate, we just weren't ready to pay for all that.
Okay, thank you.
Mm-hmm.
Question here in the center.
My question was, what is your background? And then you already mentioned too that you are paying for the R&D yourself. But what is your background?
So I'm a tech nerd, to be honest with you. Short version. I've been in. I owned a digital media agency for about a decade before actually getting involved with another healthcare tech company here in Kansas City as a CTO for several years. My background is in tech, and user experience, and so I actually had every single screen you see in this app. I actually started with a piece of paper and a pencil and sketched it out.
Another question up front.
This is an interesting idea. I'd like to approach this from the other end, which is the actual service provider, the person who does the service. Did you say how many of them you have under contract now?
We have over 500 providers that are on board. Yes.
So what has their response been? Have you had turnover? Are a lot of people already giving up and leaving you?
Yeah, it's a very good question. And I can honestly tell you that any provider that we actually got in front of and presented, we have not had one that didn't say, we want to be part of this. So as far as turnover, we haven't done enough volume to see what that's going to be like yet, but we'll find out soon. But the large companies, because there's not a solution for them to participate in on-demand home services, they are extremely excited about being part of this.
A question on the left, back here.
So congratulations on launching your app. I think this is going to be a great product. I'm curious, what areas are you looking to expand into next? And then long term, what do you want this to be?
Sure. So I think really right now our focus is really on the home itself, and which requires professional licensed contractors, right? There's opportunity to really expand on all sorts of stuff. We could get into dog walking. We've already been asked from our partner at home base that they have a lot of tenants with pets that need dog walking where they're off to work. Dry cleaning, potentially could do that, right? Someone to pick up, especially in the apartment buildings. We could notify everyone that, hey, we're gonna be there to clean clean an apartment. Do you want yours too? Or do you want us to pick up and drop off your dry cleaning? I honestly don't know where we'll end up until we're out there finding our true product market fit. So right now we're focused on the home and home services. We may venture out a little bit and see what happens.
Hey, Bo, I've got a question for you over here on your right.
Hi.
Hello.
So this is a very competitive marketplace, and I don't think you've really addressed why you guys decided to do this when there's even another company here in town, Zarly, that's doing something similar. I know it's not maybe as complete as your offering, so can you please explain a little bit more about that?
Yeah, sure. So at the end of the day, I've used every platform, every competitor out there in the space. I've used their platform. And I think the one thing that Zarly does do well is quality providers, but they're independent quality contractors. And so I'd be curious to see how they can scale that, doing independence quality contractors. But we're offering, from the provider perspective, an opportunity for the larger companies to participate in the on-demand economy. And then at the end of the day, it's not truly on-demand with Zarly. You still have to get on there and you search through their directory of who to use. They have their general range of pricing. They have their hourly rate. And then you still have to communicate and still go through some of the pain points I explained at the beginning of still checking for availability, seeing when they can come, what's the price actually going to be. And so those are some of those pain points that we're solving.
Well,
question.
Sorry. How are you going to protect yourself, because all of these other providers that are out there currently could do the same thing that you're doing currently, and they have the funding behind them. So
Sure.
how are you guys going to get in front of them?
Yeah, sure. So there's some companies out there that we just simply aren't, we don't consider we're competing against. But as far as getting out in front of them, I think that a lot of these companies that have a certain model, it's hard for them to pivot and do what we're doing. And I know that the solution that we provide for larger providers isn't something that they can just do overnight. What we need to focus on right now is instilling our brand and launching in Kansas City and trying to get some of that market share. And if we can do that, I think that we can be successful because of our product offering.
A question in the back and center.
Question for you. So all companies, even very credible ones, of course, make mistakes over time. Is there a way from the customer's side for them to blacklist certain providers so that that particular provider isn't the one picking up the job? And then also, from the payment standpoint, how do you ensure that the job has been done well before the client is charged?
Sure. So to answer your first question, we actually have a rating system built into our app for both sides so that providers, not only can customers rate the providers, but providers can actually rate the customers, which is internal. So if we have malicious behavior from the provider side, they can actually blacklist a customer. To your question, I think, was from the consumer side. And what we have on the future roadmap is not only a way for you guys to eliminate a provider that you don't want, but the ones that you do want. And then we'll actually send them the job request before any of the other providers have the opportunity.
Question right here.
How did you come up with the name and the logo?
Good question. So we wanted something that was inviting to both male and female. We wanted something short, but really the idea behind the name Lula is, me being the nerd that I am, I'm into this thing called the Chinese destiny analysis. And for every letter of a name, there's an integer. And if you put those integers into the algorithm, the definition of Lula is actually, I love spending time with my family and I love taking care of my home.
Front.
So I was just wondering how you choose to pick your providers. I know you mentioned there's dog walkings, and also I see that you have like lawn care. So do you only choose professional providers, or because you know how you have college students who want to have, you know, jobs and stuff. So if, let's say, you have dog walking, you know, maybe you have amateurs who would like to have a job and gain their own money. So I was just wondering what your process was in providing.
That's a really good question. So right now, like I said, in the future we may get into those other services. We haven't decided. I mean, there's other companies doing those things, right? But we make sure that the people that are on our platform, the providers, are true professionals at what they do. These are not people that have extra time that can go sign up on, you know, Thumbtack, for example, and say, I'm going to be a professional lawn care provider today. Everyone in this room could go do that if you wanted to. And there's a real problem with quality control. So we make sure that you're professionally licensed, you have insurance. You can't be on our platform if you don't have insurance, period. Obviously, the background checks, and then we check reviews, Better Business Bureau, and then we'll actually sit down with you and actually have a conversation about how are we going to handle when there is an issue that arises with the customer. Does that answer your question? Yeah.
Bo, last question for you. What can we as a community do to help you?
I'm very glad that you asked. So, how about we do something for each other? If the first 200 people that will sign up to on Lula's app and actually enter a property, okay, you don't have to purchase anything, you don't have to schedule a service, but if you actually just sign up and enter your location, your property, we're going to mail you a free pop socket. We have 200, so the first 200 to do that, we'll get a free pop socket with our branding on it. So, pop socket. Yeah, I knew someone was going to ask, but basically, I think a lot. There you go. One's right there. Basically, it sticks on your phone, and basically, it's an easier way. Especially the phones get bigger, so you can still easily text with one hand, but you can also set it down and actually watch something on your phone if you wanted to. So we've got 200. We're going to mail them out as soon as we have an address to do so.
I'm just surprised you can fit it in your pocket. Give them a warm round of applause, guys. Thank you so much.
All right, I'm going to grab some water.
All right. We've got a couple quick announcements, but first, it is my favorite time of every Wednesday, which is Mug Club. Raise your hand if you have been here 10 times or more. Keep your hand up if you have not received a mug. Kyle's going to run one out to you. Oh, where are you going? Where are you going? Where are you going?
Hello, can you tell us your name and why you come to 1 Million Cups?
Yes, my name is Liz Anstein. I'm a teacher at Leavenworth High School, and I've been bringing my students for quite a few years, and I come myself quite a bit because I've done some entrepreneurial types of things in and out of the city. So, and I think this is a great educational opportunity for my students.
Perfect.
Thank you.
We're so glad you bring them. Thank you. Thank you. I've got Courtney. Coming up next with a very special announcement.
Okay, so we have two events we want to highlight. All of our announcements are on this PowerPoint to your left. But tonight there is an Urban Plug event. It is for mainly people that are 18 to 30. There's 2 presenters. It's very much like 1 Million Cups, but we're trying to get the younger generations involved, and it's from 6 to 8, I believe. Double check, and it's here at the Coffin Foundation. So if you guys can come back later, we would appreciate it. And then tomorrow, 1 Million Cups is hosting an event for Global Entrepreneurship Week, and it's at 12 to 1:30, and we're bringing back some of the alumni from 1 Million Cups and kind of telling you where they are now and how they've grown their business. So please join us. And then next, I would like to bring up Julia and Susan. Julia is actually in the running for $250,000 from Frito-Lay for her invention. So she's going to come up and talk a little bit about that and how you can help her win.
Hi, I'm Julia. I've always been afraid of storms, so I would put pillows and blankets around my head, so that way I wouldn't hear or see the storm. That's when I came up with the idea to invent the Storm Sleeper. I entered my Storm Sleeper in my 4th grade invention fair. I didn't get picked in the top 10, but I still entered it on a Frito-Lay Dreamvention competition that I saw on Ellen. It is a pillow fort with a cover, Bluetooth speakers, all to block out sights and sounds. Less than a year later, I find myself here in front of you all. Now I'm a top 5 finalist out of 13,000 in a nationwide invention competition. I want to win the huge grand prize of $250,000 and meet Robert Herjavec. I can't do so without your help. So at this time, I would like you all to take out your cell phones. Okay, this will be quick and easy. I promise.
Wait, see if they're taking out their phones.
Please go to mydreamvention.com.
Make sure they all have their phones.
Can I see?
Does everybody have your phone out?
You'll be asked to give your birthday. Don't worry, they aren't collecting your information.
Tell them where to go.
mydreamvention.com.
Want to spell it?
No. Don't worry, they aren't collecting your information. Please scroll down to the Storm Sleeper and vote. That's it. I would greatly appreciate your doing this for the next 12 days through November 27th. You also can vote on your computer, laptop, and all devices, once per day on all different platforms. Please share on social media and ask everyone you know to vote for my Storm Sleeper. I would greatly appreciate your help and would love to come back as a presenter in the near future to tell you more about my Storm Sleeper and the exciting journey I have taken as a contestant in the Dreamvention competition, as well as my journey as a young entrepreneur. Until then, you can like my Facebook page, Julia Storm Sleeper, to learn more. Thank you for your help. I'll be here after the session if you want to meet and talk with me.
I'm going to ask if anyone has any questions. Here.
I'm Julia Lecce. I'm 10 years old and I'm from Kansas City. When I grow up, I want to make an impact on people. I'm really afraid of storms. I used to put pillows around my head like a fort, so that really gave me a good idea. I'm going to use it when my dad snores, and when there's a storm, it's just perfect. If I won $250,000, I would give some of it to my parents. I would donate some of it, and I would save some of it.
Julia's very aware of the world around her, and she's my hero.
My name is Julia Lecce. Vote for me and my Dreamvention, the Storm Sleeper.
Hi, I'm Susan. I'm Julia's momager. And we wanted to thank you all for your help. Julia is really excited. She's a little shy, but she's very authentic, and we're so proud of our little entrepreneur. And with all of you here, we thought that you might be interested in helping bring the win to Kansas City. So Julia, I don't know if Julia said it, but she wants to use the money if she wins for college. So we're really excited about that, and we would love your support. And if you did vote and get your phones out, it takes, you saw, probably 10 seconds. And now that it's on your phone, it'll take less. So if you do that every day, you can vote from all your different apps like Facebook and Twitter and LinkedIn. And so you can vote more than once a day, but once a day from each app. And there's only 12 days left after today. And it's a tight competition. And again, she's one of 5. So we don't know where she stands, but we think she's in the top 2. So we greatly appreciate your votes and beating, we think the the other one we're competing against is in New York, and the dad happens to be a politician, if that says anything. So we really appreciate your votes. Thank you.
Thank you so much, Julia.
You guys ready for our next presenter? Ah, that wasn't enthusiastic. Are you guys ready for our next presenter? Awesome. I've got Linda with iShare Medical. Give her a warm round of applause.
Thank you. That was very inspirational. So, I'm Linda Van Horn. I'm the president and CEO of iShare Medical. And I've been in healthcare and IT my entire career. But I founded iShare Medical because a complete medical record does not exist. And when patients see multiple different providers in different care settings, none of whom have access to complete information, it becomes very easy for things to go wrong. In fact, in a study done by Johns Hopkins University, they found that preventable medical errors were the third leading cause of death in the United States behind heart disease and cancer. This is in large part because medical records are stored based upon the provider. Each provider has a small fragment of information that is not easily shared with others. And the important puzzle piece missing in this whole relationship is the patient. At iShare Medical, we're different. iShare Medical is a complete medical record organized around the person that is easily shared across organizations, devices, software programs, and available at your fingertips 24/7, 365. And when you can get all of the information in the hands of the right people, your doctors and your patients, they can make more informed decisions. And that can lead to saving lives, improving care and outcomes, and reducing the cost of healthcare. Now, when we created iShare Medical, we knew it was going to be important for us to be able to get, organize, and share information. We started with getting the information. We became an accredited health information service provider or accredited trust anchor. These are other accredited trust anchors in the healthcare system, companies like Cerner, Athena Health, and SureScripts. And they have customers, which might be an electronic medical record system, a hospital, a doctor, a pharmacy, or lab. We are trusted to exchange information throughout the healthcare system. Once we get that information, we do something that no one else does. We organize the information around the patient, so we have a complete medical record of all of your providers in one place. And then we share that information with trusted people who have the right to have access to it. Our nationwide network spans 1.5 million direct addresses, and we are proven 100% interoperable. Now, our target markets are patients, providers, and payers. This is a big solution for a very big market. The market size is about $305 billion annually. Patients are interested in iShare medical records to get information on themselves. Providers are interested so that they can share information with other providers. And payers are interested in getting information so they can provide prior approval for services and to pay claims. Now, we've accomplished a lot here at iShare Medical. I'd like to point out two things on this chart. First of all, I was recognized in June of 2017 and elected to the board of directors of Direct Trust. Direct Trust is a nonprofit organization of 125 members founded by Cerner. And this nonprofit was created by a grant from the Office of National Coordinator for Healthcare Reform to create the trust framework for exchanging medical records in the healthcare system. The second item I'd like to point out on here is that iShare Medical was one of the winners of Launch KC this year. iShare Medical has achieved 3 levels of accreditation for being trusted to exchange medical records in the healthcare system. We are one of 39 accredited trust anchors, one of 6 Partnership for Patients trust anchors, and the crown jewel, we're one of 4 governmental trust anchors. This gives us the credentials to exchange with 23 federal agencies, including Medicare, Medicaid, the VA, the Indian Health Services. It also allowed us to land our first major client, which is a contract with a contractor for the VA. This contract's worth about $600,000 annually. But what's interesting about this is this contractor exchanges with 180,000 healthcare providers. So we have a market opportunity to go after 600 $360 million annual revenue, because each one of these 180,000 providers needs to use an accredited governmental trust anchor to exchange medical records. We think we can capture at least 5% of this market by 2019 and have sales of $18 million annually. We have onboarded our first major health system under this contract, that's Sutter Health. Sutter Health has 17 hospitals in the San Francisco Bay, Central Valley, and Sacramento, California. They use the Epic electronic medical record system. We have an amazing and experienced health IT team, and we have a really excellent advisory board who have been a great help to us. They're very diverse, and they've brought some very good ideas for us. So why should you believe that iShare Medical can do this? We have real products, real customers. We're solving a real problem in the healthcare system. We have a solution that is proven to be 100% interoperable, and we're poised to scale. So we have a patient-centric solution that is ahead of the market. And we have the right product at the right time. We're looking for your help and support in making it happen right here, right now.
Thank you, Linda. We'll start with questions from our expert panel.
Okay.
Thank you so much, Linda. I don't know if anybody else here works in the healthcare industry or around it, but the slide of your milestones is like a perfect example of how complicated the healthcare industry is. Like, I couldn't get through half of those words that you had on there because that's how complicated healthcare is. And also kudos that you have that many milestones. So as a primary care provider, I'm one of your target demographic markets. Everyone in this room is also a patient. So we are all part of your target market. I have an infinite amount of frustration with medical records and caring for people. I think all patients should feel the same way, but most people don't understand how fragmented their healthcare record is. Unfortunately, when I looked up your product and looked at what you offer, one of the very first slides you had was from the Institute of Medicine talking about how fragmentation exists because people get care across multiple providers and multiple systems. I view your product as just another system complicating things. So that's my first question, and if you want to kind of tell me why you're making the system less complicated and not more complicated, that would be valuable to me.
Okay, great. No, it's an excellent question. And so medical records are a big frustration. I think a lot of what you pointed out, a lot of people don't realize. They think that their doctor knows everything about them when we really don't have a lot of information. So one of the reasons that we're different than anyone else is we're a health information services provider. We work directly with the EHR. So we're sending the records into Cerner and out of Epic and into, so we're doing cross-organizational exchange of data. Now, we also happen to consolidate that record. So if a patient wanted to get access to the record, so we are the only system out there that allows you to view, update, and share the information across organizational boundaries.
It's on your website. It's $10 a month for a patient to subscribe, is that correct?
That's right.
I talked to, kind of talking about coming here this week, I talked to some people and I asked a lot of people if they would be willing to pay $10 a month for this service and got crickets.
I'm sorry, pardon me?
Got nothing. Nobody was interested.
Nobody's interested. Okay,
yeah.
Okay, gotcha.
How do you sell this to a consumer? How do you sell this to a patient?
Okay, so that's actually another excellent point. So if you look at a risk pyramid and you look at the healthcare dollars, 5% of the population spends 50% of the healthcare dollars. So the people that we have that are signed up with iShare Medical today are often people that have complicated illnesses. So they have leukemia. They're trying to keep track of a lot of different records going to a lot of different places. Maybe they're getting care here in Kansas City or in, we're nationwide, so they're getting care, but they're also going to destination hospitals like the Mayo Clinic or whatever, having tests run, needing to aggregate and consolidate it. If you are not healthy, $10 is not a lot of money to spend. So I do agree that if you're healthy, this may not be the thing for you to go and to purchase that. And our core really is the provider, sharing information when one provider wants to send records to another. So let me give you an example. So we have a primary care doctor, let's say, or an interventional pain, which is my background, is interventional pain, anesthesia pain. So an anesthesia pain doctor refers a patient to physical therapy. The physical therapist has to get those records certified and recertified. So the certification is the doctor signing off. So we have electronic signing of the records. So the doctor signs off, the physical therapist sees the patient, sends the medical records back to the doctor signs off again if they want more treatment or if the treatment has concluded. And so there's always this exchange of information that's happening in the healthcare system. So the providers that are using our system are using them for transition of care information. So they're sending the patient's records, insurance information at the time of referral. They're getting stuff back from that physical therapist, that surgeon, primary care doctors referring to a cardiologist, getting those results back. So that's the kind of interchange that we do. And we have a RESTful API for the technical people in the room. That's a program that the EHR vendors call. We exchange the medical records. It's transparent to the person using the system. And also then payers, because payers need information. In fact, 94%, and I actually have a slide on this, 94% of all medical records exchanged with insurance companies are exchanged via fax, either electronic or manual faxes. And this is a study that was done by the Commission for Affordable Healthcare, a nonprofit organization, and they found that the cost of processing manual or electronic faxes run about $7. We can actually reduce that cost, according to their study, to about $1.27. iShare Medical is more cost effective than that. But this study indicated that we could save $1.8 billion annually just by exchanging medical records with the insurance companies and replacing that manual process. So if you're not in healthcare, you don't realize how many faxes are actually sent still today in healthcare.
Hi, Linda.
Hi.
You make me glad I do not work in the healthcare industry. I just nod my head and pretend that I understand everything that's going on here. So a few things that struck me. One is there was a concept that you had up early that was like said your complete medical record.
Yes.
I want to point that out because I really think that is a strong concept, right? There's an inverse correlation that exists between complexity and someone's propensity to buy. And so the idea of being able to boil all this complexity down to one simple idea is very, very challenging to do, and I think you've probably done that pretty well, the idea of a complete medical record. The mere existence of that concept would indicate to somebody that, hey, your medical record is not complete. And so I want to give you kudos on that. And Allison was talking about how the market is becoming, or will continue to be highly fragmented, but I think that gives you a very strong exit opportunity. Right? The only problem with that exit opportunity is right now you're closing business on the B2B side, right? And that's where you're making your money. I want to challenge your idea of charging consumers for their medical records, and I think you should make that free. And the reason is you're able to now simply solve the chicken or the egg problem, right? As many people as you have sign up and feel like they have control and complete their own medical record. That is something that someone is willing to buy, right? So Allison said to me offline, she said, isn't the conglomeration of medical institutions in the future going to make this concept obsolete? I think she's potentially right to some extent, but you are going to be in the middle of an acquisition conversation between these large entities, which means your multiple is going to skyrocket. But it's not going to happen unless you have a ton of people that have these complete medical records. Yeah, anyway, that was my only idea. Make that free. Right? It's a huge value add for them that allows you to build supply support from the bottom of the company.
So all you investors in there, one of the reasons we can't do that, we have a lot of costs, because one of the things we have to do as part of the trust framework was we have to do identity management. So we have to vet the individual patient, the doctor, the hospitals, and lab. We just can't exchange information with anyone. We're cross-certified by the Federal Bridge Certificate Authority at medium level of assurance. That's a lot of gobbledygook, but that's equivalent of issuing a passport level identity proofing to make sure the person is really the person. And we've automated this process. We're one of the few, and I think maybe only, that have a complete remote ID proofing process at FBC or Federal Bridge Certificate Authority medium level assurance. So there's a lot of costs that we have associated with doing that identity proofing to ensure trust. There's also a lot of costs in running a big data center to ensure trust. You know, our data center is an enterprise data center. We have things like 124 cameras watching our data center. We have 3-factor authentication to enter it. We have guards 24/7, 365. We have just an enterprise level data center. So there's just costs in operating it that make that we're not able to do that at this time. But we are looking for investments. So anybody out there interested in giving us a call, we'd love to hear from you. Sorry, there was another comment.
We're going to open it up to the audience.
Okay.
We have a question in the back here to your left.
Okay.
I'm right over here.
Okay, that would be my right.
All right, yeah, you're right. So first of all, I want to commend you. I've seen other companies try to play in this space, and they don't seem to have any understanding of how they need to partner with the HR companies and how important that is. So a couple of quick questions. One, the idea of your complete medical record to me seems like doesn't really exist right now, because each one of your providers has records on what they've treated you for or what you've seen them for. So you were talking about a data center. Does this complete medical record reside in a data center that you are running?
It does.
Okay. And then secondly, you mentioned that you were a member and then a board member of an organization. Is that an organization that's trying to standardize medical records in the US, or what exactly is that organization doing? And if not, is that something you see happening in the near future? I know there's 8,000 players in that, but that would make life a lot easier for everyone.
Right, both two excellent questions. So Direct Trust was created by a grant from the Office of National Coordinator for Healthcare Reform. So this is an office that was created to reform healthcare. And it was actually created under the Bush administration, G.W. Bush, President Bush's administration. We took a look at healthcare and we said we're spending over $3 trillion annually on healthcare. How do we get control of that? And they decided that we needed to have an agency that would look at reforming healthcare, creating electronic medical records and sharing information. Now, that didn't go very far until the Obama administration passed ARA. But to get back to Direct Trust was created by the Office of National Coordinator for Healthcare Reform by a grant to create the trust framework. So what a trust framework is, it's about identity management. It's about HIPAA compliance, security, auditing, and rules about what you can and cannot do. So for example, let's say I'm a doctor. I can't send out an advertisement, or I'm a medical device. I can't send out advertisements using the direct protocol. I will be reprimanded, my account will be turned off. So there's certainly use cases that you can use this is exclusively for the purposes of exchanging medical records for the treatment of patients under compliance with HIPAA. So that's what a trust framework does, and that's what Direct Trust does. Now, there are other organizations, HL7 and the Office of National Coordinator for Healthcare Reform. So when you read the regulations for healthcare reform, they're thousands of pages long, but we have these standards that say what has to be an electronic medical record, past family social history, medications, allergies. We start looking at things, something as simple as ethnicity and race. Those things have to be codified. So we have things that actually identify, here's the races we have, here's the ethnicities we have, that you can code your stuff to. So once we begin to do that, that's what makes healthcare so complex, is there's tens of thousands of data elements. Even blood pressure, there are 8 approved ways to track blood pressure. Sitting, standing, we don't know what the patient was doing. So it becomes very complex. So unlike the banking industry where we have like routing number, account number, amount, debit or credit, and things like that, exchanging information healthcare is very complex. But we need to get a hold of it because we're spending too much money as a country. It's just costing too much. Experts believe we can save 1/3 of the cost in the healthcare system by sharing information. And so that's what we're out to do. So HL7 would be one of the main organizations codifying that. The American Medical Association creates rules over what has to be in an evaluation management service, which is an office visit. So there's a number of different rules-based organizations that are creating that, but we're definitely on that track and developing records that we can share.
Linda, question back left. With all this complexity, do you mind sharing a few straightforward, simple numbers with me? So
Sure.
How many people are on the platform right now, doctors and patients, et cetera? And what are your goals for the next year, number-wise?
Okay, so I'm actually not going to get that information out in terms of how many are on the platform now or what our goal is, but I will tell you generically, what we're focusing on right now is acquiring those 180,000 healthcare providers that are a part of our contract that need a governmental trust anchor, because we're one of the 4. There are 4 governmental trust anchors in the entire United States. EMR, iShare Medical, EMR Direct, MaxMD, and SureScripts. So we need to take advantage of that competitive position. It is a big technology lift and something that's difficult to do. What it requires is hardware and software encryption of the cryptographic keys we use to manage identity. This is the thing that makes it difficult for people to scale. First of all, the devices are expensive. Second of all, if you mess with the device wrong, a hardware security module, it will self-destruct. And third of all, many hospitals are distributed. So if you have a Cerner or an Epic, you have your own data center, then you have to deploy a pair of hardware security modules in 2 locations that marry each other to do that kind of work. So it's very complex, it's very difficult for people to do. We've done it. That's the key here is we've done it. We're one of 4 that have, and we're working on right now is scaling that up.
Another question back left.
Hi, thank you for doing this. This is a huge need in the country, and I'm speaking from the perspective of my wife, who is an OBGYN doctor. They just came out a paper about 2 years ago, 3 years ago, and they had to do that because of the mandates that were out there. So they chose a software platform. I apologize, I don't know the name of it, but it's specific to OBGYN. It's kind of one of the standard OBGYN software electronic medical record platforms. You said that there's 180,000 individual providers, but obviously there's a lot of medical activity going on there. You're talking about interfacing with Epic and Cerner and the hospital systems.
Right.
Can you talk a little bit about how you tackle the individual doctor systems that may not be Epic and Cerner? There are probably a lot of different variations of those software products, and how do you tackle that to get that data?
Sure. Well, so I'm going to use the analogy of a cell phone. So let's assume that one person has an iPhone and another person has an Android. They both get a services contract and they can make phone calls. The operating systems are very different between an iPhone and an Android. Operating systems are very different between, say, a Cerner and an Epic. But yet, we can talk to each other because they have a services provider. We're the services provider. We're the AT&T, Verizon, or Sprint that connect the EHR systems with each other. And so because we follow a standard protocol, we're 100% interoperable with electronic medical record systems, all of them. So if you are in a certified electronic medical record system, you are required by your certification to use the direct protocol. And we use the direct protocol. So that's how we can exchange with all the systems. Many of our smaller practices will use our standalone product, so you can hook in to the back of the EHR with a RESTful API, or we can do a standalone product, so you can exchange the medical records as you go to a web application, exchange those records.
Question front left.
I don't know where they are.
All right, sorry. So I have a couple questions. My first one is about the identity proofing and birth certificates that you mentioned. So I know that, first of all, is this a mobile app? Or
It is,
this, okay,
yes.
all right. So I know that people can get other people's information. So my first question would be, how can you ensure that other people will not gain other patients' information and use that to see their medical records? And my second one would be, so being in a military family and experiencing military healthcare and TRICARE, we have lost certain medical records over the years, or it hasn't been transferred to our present medical healthcare providers. It hasn't been transferred between hospitals. So how would your service be able to transfer would it be able to transfer lost records to the patient?
Yeah, so for records lost, it's lost. So we have to get it from the source. So we get calls sometimes from people that will say, there was a fire, the hospital burned down, and we didn't have access to our medical records, and can you get them for us? And we can't get something that's burned up, or something that's lost. But if it exists in electronic format, then we can connect into those systems and get access to those medical records. So identity proofing, let me address that first of all. So the Department of Commerce has defined standards for identity proofing, and so we have to go through a lot of those things. So as a part of our remote ID proofing process, you have to give your name, your information, your address. We have questions that are knowledge-based questions. So they might be like, have you ever had a fishing license in Johnson County? Is your mortgage payment a particular amount? Or you can say, it's not that amount. We also get your cell phone. So one of the things we have to do is two-factor authentication. So first factor is username and password. Second factor is a text that we send to your cell phone to verify the third factor. So there's a number of different things that we do, that we go through. We look at things like I'll stop there. But anyway, we look at a number of different things in accordance with Federal Bridge Certificate Authority Medium, which is a federal policy for what we have to do for identity management.
Okay, final question. What can we as a community do for you?
Great, thank you for asking. So we are in a fundraising stage, so if there's any investors that this interests you and you'd like to talk to us more, that would be great. If you're a patient, you'd like to download the app, our app is $10 a month, and so that may or may not make sense, as it was pointed out. If you're a provider and you need access to medical records to share them with other providers, or you're an insurance company that needs access to medical records for prior authorization or to pay claims, we'd love to talk to you about becoming a client. And if you have any feedback for us, we would love to have your help, just letting us know what we're doing right, what we're doing wrong. So we'd appreciate that.
Thank you.
Thank you.
Give her a hand. All right, folks, we've got Gilded across the hall. If you have the time, check it out. That's 1 million cups for artists. Okay, we will not have a meeting next week, so happy Thanksgiving.